progressive miniaturization of the hair follicles. So we know in the body, testosterone is converted into dihydrotestosterone through an enzyme called 5-alpha reductase. And this DHT is what causes the cycles of the hair follicles to become shorter and for those follicles to produce hair with less pigmentation and decreased caliber. So basically you get a smaller, thinner, wispier hair over time in that recognizable pattern. So here, under 60 times magnification, we can see what happens before miniaturization occurs, and then during miniaturization, after miniaturization has occurred. And this photo was taken with a hair cam microscope. It's a iPhone microscope, actually, that we use routinely in the practice. But you can certainly see that miniaturization. And basically what you're getting is shorter, thinner, wispier hairs here in 30 times magnification. And you're going to get decreased coverage in those areas. And eventually, complete baldness once the follicles shut down. So genetic female pattern hair loss, of course, is a very, very important topic. Many of our women have this problem, and it can be influenced by many factors. It's not as simple as in men. Women, in my opinion, have very highly sensitive hair. So what we can see sometimes is a hormone imbalance, like polycystic ovary syndrome, the hormone changes after childbirth, and of course with menopause. Many women are born with an androgen sensitivity, and this can detrimentally affect the hair follicles and their growth cycles as well. And of course, here's the laundry list: medications, illness, stress, nutrition, and of course environmental and social factors can also play a big concern. And so on the right-hand side, we see the progressive female pattern hair loss stages in the Ludwig-Savin scale, a widening of the part line, and a decrease in coverage of the scalp over time. Many women actually complain of a loss of volume and a decreased ponytail volume, and some can actually also have changes in the hairline, although the traditional patterns of female hair loss, we don't see that. But the good news is that we've got treatments available. So proper treatment, effective diagnosis leads us to proper treatment, and the toolbox of treatments is continually improving. It's been pretty exciting to be in the field since the mid-1990s and to see all of the different types of things that we can do now to help our men and women who have hair loss. So identifying risk factors for hair loss, implementing pharmaceutical treatments or nutraceutical treatments, using non-chemical laser therapy, and even types of cell therapy like PRP, and of course transplantation. So what are the pharmaceutical treatments that we have for hair loss? Pharmaceutical treatments include some FDA-approved as well as some off-label or compounded topical medications and oral preparations. These things target the follicle either directly or they'll reduce the biochemical triggers for hair loss. So the primary pharmaceutical interventions, as you see here, are minoxidil, which is a topical medication, and finasteride, which is an oral medication. And so we know the efficacy of oral finasteride in men is well documented. 90% of male patients will look the same or better over the long term. Here we can see some dramatic regrowth from the original double-blind randomized trial. This was published in 2002 in the Propecia arm of the treatment arm of the Propecia study. And we certainly do see a lot of patients that respond very well to Propecia and finasteride. So finasteride is mainly considered a preventative treatment, but when you intervene early and prescribe these kind of therapy like this, before the follicles are dead and gone, you can get a significant improvement in hair coverage, especially when there's a large number of weaker, wispier hairs. And when those babies improve in length and diameter, that's where you get some improvement in coverage. So you can see here a 30-year-old male. He's been on finasteride 1 milligram only for about 10 months, and his friends think he had a hair transplant. This is one of my poster boys for finasteride, and I like to show this picture when patients come to me and say, "Oh, finasteride, that doesn't really work, does it?" So I show them this photo. Additional examples of finasteride working, we've got a patient here, 30-year-old, who is a Norwood 5, and he's been on the finasteride 5 months without any procedures whatsoever. You can see the nice improvement in coverage there, especially in the frontal zone. On the right-hand side, this was a patient, interesting case, that we actually transplanted in the frontal area first, and then put him on a non-surgical regimen of finasteride, and it was amazing to see the improvement in the hair quality around the fringe of the crown and even in that frontal zone where we thought the hair follicles were certainly dead and gone. So there's some pretty interesting results there from oral pharmaceutical treatment. We see here some minoxidil results. So this is from the topical medication. We can see a topical medication minoxidil results like this in men and women. On the left-hand side, we have some of our female patients. It works in the crown. It can also work in the temple area. In the middle here, we see one of our patients who has not yet had a hair transplant and grew a pretty significant amount of hair after about 6 months on the minoxidil. On the right-hand side, you see the improvement in the crown in that gentleman and the improvement in the frontal area in this female patient. And that was with the compounded formula 82M, by the way. That was the minoxidil that we most commonly prescribe. So there are naturally derived substances that can also have a positive physiologic effect, and of course side effects that must be considered. So some vitamins and phytonutrients can be derived from plants, of course, and they're beneficial for not only hair conditioning and hair growth, but they can also help with scalp problems like scalp dermatitis and as an antibacterial agent. Here are some examples. We've got phytonutrients for hair growth, can also increase blood flow, activate the dermal papilla, inhibit DHT, and have some anti-inflammatory effects. Here are some interesting phytonutrients that are affiliated with hair growth, and we'll be reviewing some of these in the pre-conference workshop. There's some other nutrients that may inhibit DHT. Dihydrotestosterone obviously is the most well-known trigger for male pattern hair loss, and also might be indicated in some women who have hereditary hair loss as well. Over time, I found that it's been difficult trying to find reliable sources of some of those DHT blockers, but patients deserve that education, and they deserve to be tracked also if they're on some of those therapies that they've chosen on their own, for example. I'm a big fan of low-level laser therapy. We've been using low-level lasers in the office since 1999. And thanks to some brilliant researchers like Dr. Michael Hamlin, we now know a lot of the mechanisms that are responsible for the improvements in hair growth from low-level laser therapy. And Dr. Michael Hamlin, don't forget, will also be there. He's a PhD from MIT and Harvard. He's at the Wellman Center for Photomedicine in Boston. He'll be there in May in Orlando to tell us a little bit more about low-level laser therapy. I did borrow this slide from him. So what we know now is the exact photoacceptor molecule for low-level laser therapy. It's a cytochrome C oxidase sitting in the mitochondrial membrane, and that's in the electron transport chain. So we know low-level laser therapy increases the membrane potential of the mitochondria. It's setting off a cascade of events, and that would include growth factor production, as you see there, cell proliferation, pro-survival effects, and so on. And look forward to seeing all the new information that Dr. Hamlin will bring to us in Orlando this year. Low-level laser therapy can have a nice effect on our female and male patients who have, as I said before, have a lot of that thin, weak, and wispy hair. And so you can see this young lady here 5 months after low-level laser therapy with the in-office treatments. And she would typically come in 2 to 3 times a week for half-hour sessions under our laser. She's 28 years old, if I didn't mention that. Under the microscope or dermoscopy, we can see the improvement in the thickness and the diameter of those hairs that are being produced in the female pattern hair loss area. We usually see a decrease in the part width, an improvement in the thickness and the shine. Patients with longer hair can see a lot of improvement in body and volume, especially over time, with low-level laser therapy. So another example, 6 months of low-level laser therapy with a portable unit. This 60-year-old woman is seen here after a year of regular therapy with an at-home device. And I could certainly appreciate the increase in the shine and the thickness and the quality, as well as the improvement in coverage. And she was thrilled with that treatment, just by doing the treatments at home. Our go-to treatment today when it comes to low-level laser therapy is the laser cap. The laser cap is a portable at-home device that delivers quite a bit of energy to the scalp, and it's cordless and rechargeable. And you see here a laser cap regimen after 1 year of treatment with that device. Now, of course, surgical options, I'm very excited, of course, to tell you about surgical options that we have in terms of hair restoration. Hair transplantation has been my thing for since the mid-1990s. And hair transplants work, essentially, because we've got permanent follicles around the sides and the back of the scalp, and those are redistributed into the thinning and the balding areas. And the reason why this works is the theory of donor dominance, which means that those follicles around the sides and the back of the scalp are permanent. They are relatively unaffected by hereditary hair loss and many other factors that do influence hair loss. And today, we no longer have to make a big cut, use a scalpel or stitches in that donor area to get to those follicles for transplantation. We use a very sophisticated microsurgical device to perform follicular unit extraction, or FUE. And FUE is a much less invasive form of hair transplantation harvesting, and it enables us to do large sessions of tiny grafts. And as long as we use those grafts that we get in an artistic fashion with an appropriate hairline location and shape, we're going to get something that looks normal and natural. And so the angle, orientation, and position of these planted grafts is what gives us a nice result from transplants, something that's completely 100% undetectable. Now, even before we had the FUE process of harvesting, we could still do undetectable transplantation by using these single follicles or groups of 2s and 3s, as you see here in the lower right-hand corner, these naturally occurring follicular units. But now with FUE process, patients no longer have to have a linear scar in the back of their scalp. So here is an example of an FUE process during the healing phase. So this is a minimally invasive healing that you see here. Pre-op on the left, and then as we progress, day 1, day 5, and day 8, we go through the healing phase through this patient with this harvested hair follicles from the back of the scalp. So there's actually a lot less trauma and a more rapid, less restricted recovery phase from FUE or neograft harvesting. And as I mentioned before, the artistry is used to restore the hairlines, literally one hair at a time. We can see that process here. This is a recipient zone. This is where we place the hair. On the left-hand side is before the procedure. It's crusting and scabbing that would be visible in the immediate post-op phase, first day through the first week. Those scabs will flake off, and the patient will heal in about 7 days. And the growth you see on the right-hand side is after 1 year. So the benefits of FUE mentioned here. There's no stitches or staples, as I mentioned before, no linear scar in the donor area, and it's less trauma, more rapid, more comfortable healing. And there's also a lot less activity restrictions. We can use this technique, this harvesting tool, also to harvest anywhere you have a hair follicle on the body. So we can use it to harvest chest hair or beard hair, if we so choose, or anywhere else. And we can see here that hair transplantation, very effective in both men and women, a 60-year-old woman on the left-hand side here, to restore permanent coverage for both our male and female patients. And a doctor friend of ours who's had his procedure done here in Boca Raton on the right-hand side, before and 1 year after his procedure. One of the things I like to explain is how the hairline is restoring the frame of the face. And so you can see in this younger patient, who of course we would put on preventative therapies, you can see the framing of the face and the transplants growing in at 6 months and 12 months, providing nice framing and a youthful appearance of the face in this 26-year-old patient. This is a close-up view of the hairline designs that I've created. This patient had temporal point and hairline recession, and we restored both of those areas with hair transplantation. One of the most exciting developments, I believe, in recent years in the field of hair restoration has been the use of cell therapy and platelet-rich plasma. Now, platelet-rich plasma has been used in many areas of medicine, like orthopedics and dentistry, for over a decade. Hair transplant and hair restoration physicians were kind of slower to the game on PRP, but we're seeing more and more data building, and my travels internationally to different conferences have led us to a really, really interesting method of applying the PRP for our patients. But it's a relatively new modality. As I said, these platelet-derived growth factors can be used in a number of areas of medicine. So Here is Dr. Parita. Joseph Parita is here in Boca Raton, and he'll also be with us in Orlando for this conference. And he was able to use a PRP to revive the pitching career of Yankee pitcher Bartolo Colon. And so what's going on with PRP? PRP is a platelet-rich plasma that's derived from a blood sample in the office. And these platelets, as you probably know, are storehouses for regulatory, signaling, and growth factor molecules that can contribute to the recovery and the healing of the tissue. And Dr. Joseph Parita is a guru of PRP, and he's going to be with us, as I mentioned, in Orlando to share his knowledge and how this can be applied to hair loss patients. So PRP and hair restoration, because you've got these powerful growth factors locked inside the platelets, we can use those, inject them into the scalp, and get a boost of hair growth. It can be used in conjunction with other medical therapies or even as just a standalone therapy. We've been using PRP routinely with our hair transplant patients since 2011, and we use the PRP to store the grafts as well as for post-operative wound healing. So unlocking the potential of these powerful growth factors really helps us send a message to the hair follicles to produce a thicker, stronger, healthier head of hair. And Dr. Parita will give us a rundown of all those growth factors when we're in Orlando. Here's a patient of ours who had PRP for alopecia areata. You can see the bare zones that were developing progressively, and then she received the PRP treatment. And what you're looking at here is after 6 weeks and 12 weeks later, you can see the growth, regrowth of those areas. And it's been pretty amazing. Great treatment for alopecia areata, which I wouldn't say is a daily occurrence here in hair restoration practice, but certainly may come across your door. And as I mentioned before, we also use it for our male and female pattern hair loss patients as well. Mixing the PRP with other things such as extracellular matrix products, in my opinion, seems to be helpful. And we've done some interesting things with A-Cell, which is a tissue regenerating powder. It's commonly used in wound healing, and some other products to enhance the hair growth results, which we'll discuss in Orlando. So if you're doing a hair growth treatment regimen with your patients, one of the most important things to do once you've got the patient on the treatment is to track their progress, because the only thing that we have control over in our office is the procedure that we do right then and there. But remember that hair loss is chronic and progressive, so patients, it's up to the patients really to keep going on their hair restoration regimen. And the best way to keep them compliant is to do measurements. And one of the probably the most incredible inventions that I've seen in the field of hair restoration over the past 17 years is a cross-sectional hair bundle measurement, and that's called the hair check for short, invented by Dr. Bernie Cohen. Enables us to track very specifically in the same area of scalp over time the improvements or loss from various treatments or procedures. So one of the things that this really does is help us improve compliance with our patients, and we'll go through some of those protocols in Orlando when we're there in May. So I wanted to thank you for your attention tonight. We want to be sure that you are knowledgeable about the Thursday, May 15th date. That is the pre-conference workshop that we will be offering, the medical management of hair loss. We hope to see you there at the A4M. It's going to be an exciting time. We'll spend a lot of time going over many of the things that we talked about tonight in much, much greater detail. If you have any questions for us after viewing this webinar, I encourage you to you can email us or contact us through those links below, and we look forward to seeing you there.
Thank you so much, Dr. Bauman. Thank you, everyone, for attending this webinar, and thank you so much, Dr. Bauman, for your effort and your time. That was a great presentation. Again, I hope you guys learned a lot, and please don't forget to call 888-997-0112, extension 7529, for the $100 discount off of the workshop price. Again, this is a pre-conference workshop, a part of the 22nd Annual World Congress on the Anti-Aging, Regenerative, and Aesthetic Medicine in Orlando, Florida. The conference is May 16th and 17th, and this workshop, again, is offered May 15th. So I highly encourage anyone to register for this. You can register at our website, a4m.com, or again by calling our office. Again, thank you so much, Dr. Bauman. That was great, and I hope everyone learned something. and we'll end it here. Again, please submit any questions you may have at the chat option, or you can email me, Jordan Nelson, at jordan.nelson@afarm.com for any questions. Thanks so much, and have a good night.